Now give me a mic check.
Hello everyone, we're having a little problem with our volume here, or mic check. Got anything?
Yeah, we're good.
Okay.
You guys, if you can hear, give us a thumbs up.
Hello everyone, we're having a little problem with our volume here, or mic check. Got anything? Okay.
That did it. We're good to go. Let me write it down.
I got it. Hello everyone, hope everyone's having a good day. I'm going to move right along here because we've got a lot to cover today. We've got several people that's going to talk to you today. Let me write this down before I forget it. Been on the phone today, just a few minutes ago, with the park out on the mountain again. I don't want to start with that because they do have, they're working with the administration and the park people here locally, and they're hoping to, they may not be able to totally remedy the problem, but they're talking about possibly letting a few more cars in or whatever. They're working on a plan, trying to finalize that by tomorrow, and we'll know more about it tomorrow, but they've got a lot of people involved in it because this is not the only park they're worried about. This is one of the largest, or they have the most visitors, but they've had the problem in several other parks throughout Georgia as far as the parking on the outside and walking in. So we'll update you tomorrow on our Friday update about that, and we'll know more about it. Want to mention too, as we do every day, and Carey's going to comment on it too. She'll come on here about our early voting. It's going on right now. You've got 3 weeks of early voting, to go up to the final day, so there's no excuse for you not to get out there and cast your vote. I want to mention too, we are going to be closed. The government offices all will statewide will be closed for Memorial Day on Monday, and also we've talked about this in the past, but Daniels Road is maybe not big news to a lot of people, but the people who live down there that's going to be affected by this. Daniels Road and will be closed, and also Dugan Loop, it says here. I'm sure Daniels Road, but Dugan Loop I'm not sure, but that's what they're telling us. They're going to be closed from June the 1st to July the 15th. So we'll mention that periodically here as we go along in the next week or a few weeks, kind of where it won't catch people off guard. And of course, our EMA people, they'll be totally aware of it if we have to have emergency vehicles get in there, fire department or whatever. Do want to say too that our downstairs they start at 1 o'clock today, and they do that Monday through Thursday as far as the COVID testing. And that is a swab test. I mention that every day, but it's every day someone calls and says, I'm glad you said that because they had forgotten about it. It's real easy. It's simple. Don't take a lot of time. It's a drive-through. They do it, like I said, 1 to 4 on Monday through Thursday. Fridays, tomorrow, they'll be 9 to 1, and they'll even be here Saturday from 9 to 12. And it's still also the Lawson Medical. They're still doing the antibody test over, which is a blood draw. And it's just over across on the square over there. Now there is a charge for that. The health department, of course, it's free. And the place in Lafayette also in Walker County at the Civic Center. That's the health department over there doing that, and it's free also. And from what I understand, they're doing that 5 days a week. Let's see if there's anything here. Got that and that. Okay. We'll go ahead and into my numbers here, or our numbers. Dade County, we stayed the same at 20. We do have 11 antibody tests that you can deduct from that. Walker County, they were at 77 yesterday, and they're at 81 today. They have 44 antibody tests that actually is in those numbers. Catoosa County, they went from 75 to 77. 17 for Chattooga County yesterday, and they're up to 19. Whitfield County went from 194 to 210. Gordon County, they went from 132 to 134. Floyd County, they went from 196 to 210. Bartow County, 413 to 419. And there's today, as we speak, 2,614 unknown counties that's still out there. And as I always say, that some of those could be ours. Tennessee, they have in Hamilton County, they went from 377 to 402, and they have 161 recoveries. Marion County, they went from 34 to 35, they have 24 recoveries. Grundy County, they went from, they stayed the same, actually, they have 26 recoveries. Sequatchie County, they stayed the same, they're at 9, they have 7 recoveries. Midge County stayed the same at 22, they have 19 recoveries out of 22. Bradley County, they stayed the same with 84. They have 69 recoveries and 1 deceased. There's been a total of 309 deaths statewide in Tennessee, and Georgia has a comparatively 1,724 deaths in Georgia, and that's up from yesterday of 1,684. Alabama, we moved down to Jackson County here. They went from 64 to 66. DeKalb County, they were at 200 yesterday. They're at 206 today. So all those numbers have increased. We'll move on into a couple of things here. We've had a call or a few calls this morning pertaining to Dade Health and Rehab out on the mountain, and I've got the administrator of that group out here with us today, Miss Massengale, and she's going to give you an update on exactly. This is coming straight from Dade Health and Rehab, exactly what's going on out there for all the family members, anyone that has heard anything about this out there. So if you want to come on up, Ms. Massengale, we're just glad you come in here and appreciate you talking to us.
So good afternoon, everyone. I've been in long-term care. This is my 40th year. Recent administrator, been promoted to administrator at Dade Health and Rehab when this COVID pandemic had started. We had remained with no activity as far as since the beginning. But as of this morning, well, actually, let's go back to Tuesday. Tuesday, we did some testing. CMS and the Center of Medicaid Services and also the CDC, the Center of Disease Control, is mandated, well, not mandated, but they strongly encourage us to do some testing of our residents and staff, and we're working on that process right now. With that being said, there were 8 tests done on Tuesday, and this morning at 6 a.m. I received a call that those tests had came back, and 5 were positive. They were 4 of our not even direct care staff. They were 4 of our department heads that really have not a whole lot of resident contact, and also 1 of our residents that had not been out of the facility. Prior to COVID, well, let's go back to that, the testing. Okay, so to alleviate fears, we're concerned because we took these 8 tests out of a different packaging. It was a different type of serum test. It was still the nasal swab, but it was a new package of tests, is what I'm trying to say. So we're not sure if maybe it was a false positive. We have retested all of those people that tested positive, all 4 staff members as well as the 1 resident. As of 1:30 today, they were all retested and sent to the lab, and we're awaiting those results. They may come back as early as tomorrow. We're going to be transparent and honest about it all. We don't have anything to hide. We have taken precautions from the beginning of the pandemic. We have screened all of our staff that come in. They cannot enter with a temperature of Even 299s 2 days in a row, or even 100-degree temperature, they cannot enter, or if they've had any of the symptoms that go along with the COVID-19. We have a ongoing infection control isolation unit where all of our admits back from the hospital come in one entrance, go out if they have to go to the hospital through one exit, so that we keep all that traffic down. We use one of our entrances for our staff where we have a setup of our screening information that we do. So it's very strategic in how we handle all of our staff and residents. A lot of prayer. And I don't want to go by and not mention the Lord in this, because, without Him, we can't do what we need to do. I've been in healthcare for a long time, and this is the worst crisis that we've ever had to walk through. And from the inside looking out, it looks different than the fears that other people have, or speculation, or what are they doing in the nursing home. And we know you can't see your loved ones right now because of safety reasons, and we're trying to make sure that resources are available so that you can actually see them on FaceTime or Skype or whatever means to let you know what we're doing. We don't want to hide any information. I'm a very transparent person. If I know the information, the first thing I did this morning was talk with my staff and tell them what was going on so that we could try to help them, deal with what we have until we get all of our information together from the lab. So these are presumed positive. They came back positive, but we're not sure there was not a bad batch of testing. So, and I'm not saying they won't come back positive. I'm saying we're doing everything we can to make sure our staff do not do non-essential travel, that when they're on their off-duty times, that they're not going and sitting in restaurants, that they're not putting themselves at risk, which ultimately puts our residents at risk, because our residents are the elder population that we serve, and that is their home that we're privileged to work in. So from a healthcare, I take my role very serious. I know a lot of people have their own take about what's going on and who's doing what, and nursing homes are under scrutiny right now because of all the negative publicity. And so I welcome the opportunity to be able to come today without really any notice, but to be able to come and share our story, because I have an amazing team. Without them, I couldn't do what I do every day. And I have a support system from Reliable Healthcare Management. We're one of 7 homes that's in the Rome and Atlanta and Cartersville and then Cleveland area. And they have backed us with their support as far as trying to get us what we need as far as our personal protective equipment, supplies. We are making our own gowns now. We make sure that everything that we have that we're using is top notch. We don't take whatever I need. My corporate office is going to make sure I have it. Cost is not a deciding factor right now. We don't want to take any chances with the safety of our residents. We know it's a very serious situation. And here in Dade County, we know there has been not very many cases, but one case is too many. So with that being said, I just want to make sure to let you all know that we are retesting, that eventually there is, it's being strongly encouraged that we do test all 100% of our residents and staff. We're working on a plan to get that done, as well as working on staffing issues that arise from that. The 4 that tested positive of our staff were immediately sent home. They cannot come back in the facility until we obtain a negative test from them. Whether that test was accurate or inaccurate will be the deciding factor of when they can return to work, because we don't want to put any of our residents at risk if we do have a positive case that we're unaware of. So I wanted you to hear from me as being a frontline worker that's involved every day, hands-on with what's going on in the facility and trying to direct traffic and make sure that our staff have what they need to take care of our residents, as well as kind of put to rest some of the fears and concerns of what's going on internally in the building because of loved ones not being to visit. But I can tell you, my heart's in long-term care. My heart is for the geriatric population. That's why I've spent my whole life and devoted my whole life to it. And I ask God to control everything I do and everything I say as far as how I handle staff and residents' concerns, because that is the top priority. So we are praying for these tests to return back negative, that it would be a fluke. We don't know how all that's going to work out. That is my prayer, even as we're having this discussion. The resident in question was, she has not been moved off the isolation unit, so she was already in the isolation unit when we got her test result. So we didn't have to do anything there as far as isolating her, because she is already in that unit. And I want to give you my contact information, because if anybody has concerns about the nursing home or what we're doing, or I'd rather be able to share that information with you myself than people just add their own interpretation on that. And I think it will help to people to come about things in a calm manner, because as soon as I have information, I'll make sure that others have information. Residents and families, we started contacting right away. But my name's Trina, Trina, Massengale, Massengale. Our number at the nursing home is 706-657-4171. I'd be glad to speak to anybody that calls with any concerns they may have. I share what information I have. I'm also a nurse, so and like I said, I have a lot of long-term care experience. We do have an ongoing reputation with our own personal National Guard now that has been coming twice a month to do disinfections of our common areas in our nursing home. They were just there this week. They have been there 3 times, ongoing. They come, every 2 weeks they come, and they do our floors, they do the fogging, they do it all while we keep our residents in their rooms and things like that, to make sure that all of our sanitary needs are being taken care of. We are wiping down handrails constantly, continually. Have my social worker that's been doing that. Awesome housekeeping staff that's making sure everything is clean, all surfaces are cleaned, that we're using not reusing masks, that we're getting new masks, that we're taking every precaution necessary to make sure the safety of the people that take care of your loved ones. So I'm thinking here if there's anything else I need to mention.
We do have one question.
Yes, ma'am.
We do have one question for you, and that is, were these people tested randomly or were they symptomatic?
Oh, I meant to say that. All of our healthcare workers had no symptoms. They were tested by their own choice. None of them, all 4 of them, had no symptoms. Our resident presented one symptom, which was a sore throat. No one had a fever, and there were no other symptoms that went along with that.
Thank you.
So anyway, thank you for this opportunity, and I may come back another day and share some more as we get some more updates. Thank you very much.
Thank you for coming down. That's a really good report, and that's as I mentioned before, that's the reason we are doing what we're doing right now, is to let you know exactly what's going on in Dade County, and that right there is really a good report. It keeps people, because this is just hours old. I mean, it's just really so. It's really a good thing that she's came on here, and you heard it straight, as those saying goes, straight from a horse's mouth. And actually, next week we hope to have what was the director when you were?
Brad Bilbo.
Yeah, the director of the facility, which
CEO.
He's the CEO of it. Hopefully, one day he will be on next week. Hopefully, the first of the week, and we'll give you more details on exactly what's going on and what's happening out there at Dade Rehab. Carey, have you want to let Dr.
Harris.
Dr. Harris on? Okay, got Dr. Harris here today. We also have our Paula, our property. I started to say something I'm not going to. And Marshana from our library. So we do have a lot to cover here today. So try to stay tuned here and listen to us and we appreciate it. Dr. Hanks?
Thank you, Mr. Rumley. Hello, everyone. I have an announcement regarding summer meals. We concluded yesterday with the school meal distribution, and I want to commend our SMP staff and our bus drivers and many volunteers, parapros, teachers, and others who helped distribute more than 155,000 meals since the shutdown to the children in Dade County. So thank you to them. And now we turn our attention to summer meals. And that will begin next Wednesday, May the 27th. So from 10:30 to noon, students are able to pick up summer meals. This will be available to all children and teens from 1 to 18 years old. This summer, children can continue to enjoy school lunches at no charge through the Summer Meals Program. This is a federally funded summer program at no cost to the residents of Dade County. So that's good news. It's open to all kids from 1 to 18 years old. No applications are necessary, and all children and teens are welcome. In addition to lunch, breakfast is also included in our meal bags. This program is a continuation of the regular school program that was going on during the pandemic. However, the contents of the meal bags will be somewhat different. We're trying to make sure all children eat healthy food during the summer months. To help parents and guardians, the meals are available for pickup at Dade and Davis Elementary on Wednesdays from 10:30 to 12 noon, and at the library. Marshana Sharp, thank you for helping us from 12 until 2. Summer meals make certain that our students have access to nutritious foods that will help them retain what they learned throughout the school year. Children who are hungry or food insecure are more likely to be in poor health and less likely to learn. Summer meal programs can respond to that situation. Plan to drive through and pick up meals for 7 days for your children at the same time and pick up a produce box. This is a 20-pound produce box for the family at no cost. We look forward to seeing you. Now, one thing that will be different this summer is that unlike in past years, due to the COVID-19, meals are not consumed on site. So that's different. And parents or guardians can pick up meals for their children. So if you have any questions about it, please feel free to contact me or anyone at the Dade County Board of Education. In closing, I just want to share with everyone that we've made the best out of a bad situation. I'm very proud of our students, staff, and parents with the way that we continued with digital learning. And this week is the grand finale of the school year. And if you check our social media sites, you can see a lot of celebrations. This morning we had a drive-through celebration, graduation celebration for the 8th graders. Tonight we're having the 5th grade drive-in celebration at Davis. Last Friday we had it at Dade Elementary. And then this Friday night we're having a graduation celebration. So at the drive-in. So we're very excited about the good news from our students and very proud of them. The last thing I want to say is that many of you, as I'm out and about, have stopped me and asked me about reopening. So very briefly, because I realize there are many others who need to speak today, I want you to know that we are working on a plan for reopening, and we are working closely with the Georgia Department of Education. Superintendent Woods and Governor Kemp released a statement to superintendents yesterday that they are creating working groups to help guide the reopening efforts. Yesterday I received the latest CDC guidelines, which I shared with our principals and our leadership team. And we are making sure that we have all of the safety protocols in place, including having the sneeze guards, the PPE equipment, and today we started using the sprayers. It's a piece of equipment, and Mr. Rumley, now the name of the equipment is failing me, but it sprays a mister.
Yeah.
And it sprays a huge room, like 1,000 square feet, I believe. It's very expensive, and we're very proud that we were able to get that through extra funding that has come our way because of the pandemic. So we have 6 of those to be using. We're already using them in our schools, and we are working up a plan. We're looking at alternate educational ideas. I'll just leave it at that. I'm going to be sending out a survey in the next few days to the parents to get input from the parents, and we'll be working through it. But our hope is that we will be following the schedule that the board approved back in January. So we're hopeful that we will start school as scheduled in August. But you'll be hearing more about that in the days and weeks to come. And so God bless each one of you. Stay safe. And to all of our little children out there, our boys and girls, we love you. We're so proud of you. You've just done a great job. And we can't wait to get you back in school. So enjoy the longest summer ever. And we'll see you real soon. So read as much as you can. Get outside and enjoy the sunshine. Mwah. We love you. Bye.
Marshana, you want to come on up? We'll let Paula do last.
Okay, thanks. Okay. I was going to talk to you about the census, but I'll go ahead since Dr. Harris mentioned the lunches. I know that we're closed the next 2 Wednesdays, but we will be giving out the lunches. If you'll just come down the drive, like where the book drop is, you'll come to that side door, and that's where we'll be giving the lunches out, right there. So I did want to talk to you about the census. We want to make Dade County count. Carey and I are working with the Census Bureau, and they are sending us numbers. And right now we're kind of low at the percentage rate that's usually put in. If you come by the library and fill out your census, you get a free swag bag. It has a lot of different things in here. We have several of them to give away. So if you need help, we have a computer set aside just for the census. Please come by and we'll help you. But don't forget to spend, it really helps the county in several different ways. So please remember to fill out your census. And we are doing summer reading this year. We've had several calls. It's just going to be a little different. If you would go to our website, it has some explanations on there. And if you'll call us, we'll explain to you about summer reading. But we are doing summer reading. We have some really cool prizes, and it's for adults, teens, and children. All right.
Thank you. Paula.
Good afternoon. My name is Paula Duvall. I'm the Chief Appraiser with the Assessor's Office here. I just wanted to go over a few more things regarding the assessment notices that were mailed out last week and the appeal process. If you did not get an assessment notice and you own property in the county, just let us know and we'll make sure that you get your assessment notice. Now what that assessment notice is just giving you the notice of what your value is for 2020. And that starts your time to appeal that value if you do not agree. Now at the bottom there is an estimated tax. That is not an appealable. You can't appeal your tax. You can only appeal your value. And again, I strongly stress this is just an estimate of your taxes. This is not what your tax bill is going to be. And this, your assessment notice, is also not a tax bill. This is not the time to pay any taxes. Those will come out around September. So just keep that in mind. If you have any questions about your assessment notice, just give us a call in our office, 657-6341, and we'd be more than happy to go over those things with you. And when you do file an appeal, the Board of Assessors does have 180 days to look at that appeal, review that appeal, and make their decision whether they're going to make a change according to the appeal or whether they are not. So just keep in mind, once you file your appeal, it may be, some time before you hear anything back from us. If we do make changes in the office, I do have to take it before our Board of Assessors, who only meets once a month. So I cannot send out any change of assessment notices until I present them to the Board of Assessors. So it's not a quick process. It could be a long process, so just be patient if you file your appeal. We are working on them and reviewing them. And another thing I wanted to discuss is the market value. We have a lot of questions or comments that, well, I haven't done anything to my property, so why did my property value increase? Well, the market value is not necessarily based on what is on your property or whether you've changed anything on your property. The market value is simply based on how the market is working in our county. If the market values, whether it's new homes or homes that have been here, that is what determines whether we make any changes or not necessarily if you've made any changes to your property. And one more thing I wanted to talk about is the senior exemption. We do get a lot of questions about the school tax exemption. It is for age 65, and it does have to be your primary residence. Now, this exemption only exempts your house and up to 5 acres. So if you have any acreage above 5, you will still pay school taxes on that additional acreage. Or if you have any other buildings on your property besides your home, you will still pay school taxes on those accessories that we have listed in our system. So more than likely, nobody is totally wiped out of their school taxes. You're still going to have a little bit of school tax on your bill. So just keep that in mind. I just wanted to give that reminder out. We do get a lot of questions about that. And again, if you have any questions, you have until June 26th to file an appeal if you disagree with the value on your property, or give us a call, 657-6341, and we'll be more than happy to answer any of your questions. Thank you.
Good afternoon, everybody. I wanted to remind you to vote. Some of you have received this in the mail. This is a request for an absentee ballot application. You may have received a couple of these. One of them is blue and red and white, so that was sent out to you, and then the Republican Party sent this one out to you as well. You don't need to fill both of those out, only one. And if you have filled out an absentee ballot application and you decide that you want to vote in person during early voting, just bring in your absentee ballot application with you. You do have to turn that in to be able to vote. Early voting has started. It started Monday. We're averaging about 100 people a day for early voting. That's a very good number. We would like to see it be more. Doesn't matter who you vote for, but it does matter that you vote. So please come out and exercise your rights to vote. If you have a question about early voting schedule, it is Monday through Thursday, 8 until 2, and Friday, 8 until 5, and Friday from 8 to 2. There will be an early voting one Saturday closer to the election. To see that schedule, you can go online at www.dadecountygeorgia-ga, dadecounty-ga.gov, and check out that Vote 2020 tab, and it will show you the early voting schedule. There's also the number to elections there. If you have any questions, you can give them a call as well. And we did get a couple of questions for the school about, and I don't know if Dr. Harris wants to answer those in a moment, about if you will continue online learning perhaps or not. And then somebody else also asked a question about the CDC guidelines that were floating around on Facebook for schools and how disturbed parents were by that. And I just wanted to say, we didn't put that out and the schools did not put that out.
Back to them on here.
Sure. So we didn't put that out, and so we're not sure where that came from, but that's part of the reason we do this every day, is to combat misinformation. So we want you to hear it from us first. If the school has anything to report, they do a great job putting out all of their information. They communicate every day with parents via text, via email. So if you have any questions for the school, I would encourage you to go directly to the school. If you have questions about misinformation, please let us know and we will try to answer that for you. But there is a lot of misinformation going around right now. Again, if you check out our COVID-19 page, there is an actual link to the CDC that you can click on, and it will tell you if something is or is not valid information. So please check that out. If you have any questions, come to our county website, message us. We will message you back. Go to the school, go to the library, the property assessors. Go to the right places to get the right answers. So we would like to encourage you to do that.
Okay, I appreciate everyone tuning in today. I think you got a lot of information there to absorb, and you can always go back. Evan always plays and replays this over. You can go to our website and watch it. And I think didn't you say it's on YouTube too? Don't you post it on YouTube?
Yes.
Oh, okay. And I do want to remind everyone today at 4:30, the Governor Kemp, will be giving an update. I'm not sure what it's about. I'm sure it's going to be about COVID-19, but he's got a lot of people listed that's going to speak today. Even the Parks Department and a lot of people. He's got about 6 or 8 people that's going to speak, so it'll be a pretty interesting thing there. So it'll start at 4:30. Evan we'll air that. Okay, Evan will be. It'll be on air there with Evan. We will have it on our Facebook page. So if you can, try to tune in, and we appreciate everyone that came in today and talked to us. And my number is 667-8999, area code 423. It's my cell number. And if you have any questions, 7 days a week, call me, or you can, as I say, go to our website, and Carey, she monitors that regularly. So we'll see you back tomorrow at 3 o'clock, and appreciate everyone.